Okay, so hi everyone. Welcome to this really exciting webinar on dog ownership, mental health and planning. First, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the land in which I currently stand and work, and pay my respects to elders both past and present. My name is Marlee Bower, and I'm a research fellow at the Matilda Centre for Research in Mental Health and Substance Use at the University of Sydney. And today I'm really excited to welcome you for what will be a really, I think, awesome webinar and the third in a series in a collaboration between the Matilda Centre and the Henry Halloran Trust, both here at Sydney University. And today's webinar is going to be looking at the relationship between dog ownership and mental health and how cities can be planned better to support dog ownership. And today we have two awesome speakers, Dr. Lauren Powell from the University of Pennsylvania and Dr. Jennifer Kent from here, Sydney University. And before you ask, yes, all the photos on each of these photos are of my dog, Winnie, and you'll see more and more of her over time. But I also want to talk a bit about the network itself and a bit of a history around that. So the network is formally called the Network for Research in the Built Environment Mental Health, and started with a workshop between academics and practitioners, which Jen was also at, in the areas of psychology, mental health, physical health, urban planning and architecture. And we all came together because we had noticed that our experiences of work in our work of daily life, that there was a strong relationship between the built environment and mental health, but not so much for common language to talk between all these different disciplines. And so, for example, my own research looking at social isolation and loneliness amongst people experiencing homelessness and social disadvantage, it was clear that the inequity in the type and quality of spaces that are allotted to these groups in our society and don't really take into account the personal needs and values of these groups. So the relationship between the built environment and mental health is kind of complex. We formed this network to look at these issues in a way that was interdisciplinary and collaborative. So we have multiple aims, which are number one, to bring together the researchers, the policymakers and practitioners currently working independently across silos to share skills, expertise and develop frameworks. But we also want to promote the role of mental health in the built environment practice and research settings and vice versa of the built environment and planning in mental health settings. We want to build capacity and translate research evidence into public health and planning policy and practice through inbuilt partnerships with practitioners in the field. So if as a practitioner or policymaker, you're interested in either joining the network or being on a list to hear about further events or publications, please register via the link you'll receive tomorrow in a follow-up email about this webinar. And please share any comments about things you'd like to see in the future or research you might want to be part of or think about. So now off to our presenters, our speakers, I should say. And first up, we have Dr. Lauren Powell. So I might just get Lauren to share your screen now and I'll stop the sharing while I introduce you. So Lauren is a postdoctoral researcher with the Shelter Medicine program at the University of Pennsylvania Veterinary School. She was awarded a PhD here at the University of Sydney for her research into the mental health effects of dog ownership and the role of oxytocin in human-dog bonding. Her current research sees her investigating the experience of unsuccessful animal adoptions for both adopters and animals and assessing the quality of life on cats and dogs at animal shelters. Thanks. Over to you, Lauren.
Thanks for that introduction, Marlee, and thanks for inviting me to speak with you today. So I am now at the University of Pennsylvania, but the research that I wanted to talk about today was done at the University of Sydney, and it was looking at dog ownership and mental well-being. Now, before we dive in and have a look at the research study itself, I just firstly wanted to introduce some possible pathways through which owning a dog may benefit our mental well-being. Now, I've listed 3 pathways here. I think the first thing to recognise is that this list isn't necessarily exhaustive. I think there's certainly other ways in which owning a dog may be good for our mental health. But this is certainly 3 of the pathways that we commonly see recognised in the literature. So the first possible way in which owning a dog may benefit our mental well-being is through physical activity, and particularly dog walking. The second possible pathway is through the companionship and social support that dogs can provide us. And the third pathway that we're going to have a quick look at is the role of hormones in human to dog interactions. So when we consider physical activity, the research shows quite strong links between physical activity and mental well-being. Physical activity can help people with mental illness to manage their symptoms, but it can also promote a positive mood and other positive mental outcomes. But when we look at population levels of physical activity, we find that a significant portion of the population is inactive. And so any way that we can motivate people to perform physical activity really is a good thing. And I think this is where dogs come into it. So dog walking as a form of physical activity is unique because it provides a purpose to that exercise. But dogs also have an ability to motivate their owners to perform physical activity. I'm sure many of you, if you own a dog, are familiar with the feeling of getting home after a long day and the last thing you feel like doing is taking the dog out for a walk. But when they're, super excited to see you and jumping around at your feet, it can be quite difficult to say no. And so these two things together, the fact that physical activity becomes purposeful and dogs can motivate their owners, can help to produce long-term engagement with higher levels of physical activity. Now, we also see this in the research. So there's been some studies, for instance, that found that dog owners in the UK were generally more resilient to poor weather conditions. So on a rainy day, they'd still be out there walking their dogs, whereas perhaps people that didn't own dogs were more physically inactive on those days. And so studies have shown that dog owners do walk for a median of 160 minutes per week. So owners can meet the physical activity guidelines that are recommended by the World Health Organization through dog walking alone. The second possible pathway that I mentioned was through the emotional support and companionship that dogs can provide. Now, again, this is multifaceted. So firstly, dogs can provide companionship, which may help to reduce feelings of loneliness itself. But dogs can also allow their owners to meet new people in the neighbourhood. Now, this is often referred to as the social catalyst effect. And basically what that means is research has shown people are more likely to approach a stranger if they're accompanied by a dog, rather than if they're just by themselves on the street. So that's another way that dogs may help to boost owners' social networks. And then finally, the company of a dog can also help to buffer our stress. Now, a lot of the evidence here comes from stress tests. So owners will be asked to undergo either a maths test or a mock job interview or another sort of experience that is suggested to be stressful. And what's been found is that when owners are accompanied by a dog, we see a lower increase in their stress compared to people that undergo those tests by themselves or even with the company of a spouse. Now, the third pathway that I mentioned here was the role of hormones. So I've listed two hormones here, oxytocin and cortisol. And these are the hormones that are most frequently associated with human to dog interactions. So oxytocin is often referred to as the love hormone. It plays a really important role in maternal relationships, but also romantic relationships and friendships. And research has also shown that when we interact with dogs, we can have a boost in our oxytocin concentrations as well. And then the same for them. Dogs often have an increased oxytocin level after they interact with their humans. So being a feel-good hormone, that's obviously a positive thing for our mental well-being. And then on the flip side of that, interacting with dogs can reduce our cortisol levels or our stress hormone levels. So we have these three hypothetical pathways through which owning a dog may benefit our mental well-being. Except when we look at the current scientific evidence that looks at dog ownership and mental well-being, it's certainly not clear-cut. Now, I've given some examples of loneliness here, but the similar type pattern does exist for other outcomes of mental health, such as depression. So this graph here comes from, it's just from a blog post, so it's not necessarily a robust scientific review, but it did show that of the 21 studies that the author could find regarding loneliness and pet ownership, there was really mixed results. So only 6 of those studies actually found that pet owners were less lonely than non-owners. 3 of the studies produced mixed results in that some segments of the population, such as women living alone, were less lonely than non-owners, but other segments of the dog owning population didn't necessarily differ from non-owners. And then, as you can see, 11 of the studies found that there was no difference between pet owners and non-owners. Now, there is a lot of different reasons that could explain this inconsistency in the literature. And unfortunately, I don't have time to run through them all today. But these challenges that we see in the literature are some of the things that we tried to solve with the PAWS study. So the PAWS study, or the Physical and Affective Wellbeing of Dog Owners study, looked at a range of health measures. And the main thing that we were investigating was how dog acquisition could affect human health. Now, obviously, today we're going to focus on the mental well-being side of things, but we did collect measures of human physical activity and sleep patterns. We collected other measures such as blood pressure or cardiorespiratory fitness. We asked some questions about the dog owner's social interactions. And we did also collect some measures from the dog itself. So we recorded their behaviour and also tracked their physical activity through a little tracker on their collar. Now, in terms of mental health, there was 4 different aspects that we looked at. So the first thing was loneliness. We then looked at feelings of positive mood and negative mood, and then symptoms of psychological distress. So here, this includes things such as feelings of anxiety or depression. Now, I know this study design is a little bit complex, but I'm just going to quickly walk you through it so that we can make some sense of the results. So basically, we had 3 different groups of people who participated in the study. In the green, you see we have our dog acquisition group. So this was a bunch of people that at the start of the study didn't have any pets. They then underwent their baseline measurements, so they completed all of their mental health questionnaires along with the other measures of health, and then they acquired a dog within 1 month. These people then underwent their midpoint measurements at the 3-month point and their final measurements at the 8-month point. We then have our yellow group, which is called our lagged control group. And this is basically people who didn't have any pets at the start of the study, but said they were interested in getting a dog. However, they agreed to delay a dog adoption until after the study was over. They also underwent the similar measurements at the baseline 3-month and 8-month point. And then we have our orange group, which was another control group, our community control. And this was basically people who didn't have any pets and didn't have any interest in getting pets in the near future. So we included these 2 different groups, the lagged control and the community control group, so we could see whether there's any differences between people who are interested in dog ownership and people who are not, irrespective of the dog, and we could compare that to our actual dog adopters. And in total, there were 71 people who participated in our study. So here we have the 4 results from the loneliness, positive affect or positive mood, negative mood, and psychological distress. And we'll jump into these in a little bit more detail. So starting off with loneliness, obviously along the bottom, we have our timeline. So the baseline measurements, the 3-month measurements, and the 8-month measurements. And along the side, we have the score. And so here, a higher score reflected increased feelings of loneliness. So you can see in our green line here, our dog adopters actually had the highest levels of loneliness at the start of the study. We saw a significant reduction at the 3-month point, so just after they had acquired a dog. And then loneliness sort of flatlined at that lower level until the end of the study. Now, comparatively, the two control groups showed a little bit of movement, but it certainly wasn't as much of a clear pattern there. And there was no significant differences in the control group. We just saw that reduction in the dog adoption group. Now, when we look at positive mood, we see a similar type pattern, except obviously in the opposite direction. So between baseline when the dog adopters had no dog and the 3-month point when they had just recently acquired the dog, we see quite an increase in positive mood, which then stays level at that higher rate till the end of the study. Unfortunately, this result didn't come up as statistically significant when we ran our tests, and that's likely due to the amount of variability in the data, which is another challenge with conducting research in this human to dog space. But nonetheless, there certainly seems to be a trend of increased positive effect. Now, when we look at our negative mood, we again see the similar type pattern to loneliness. So our dog adopters had the highest levels of negative mood at the start of the study, which then decreased by the 3-month point and stayed at that lower level until the 8-month point. Although again, this difference didn't come up as statistically significant when we ran those tests. And then finally, we have our psychological distress. So here we see, again, quite a decrease in feelings of psychological distress between the start of the study and the 3-month point. But there is a little bit of a rebound to the 8-month point, although again, this did not come up as statistically significant. So when we put that all together, all 4 measures are showing a really similar pattern in that dog ownership does appear to have a positive effect on our mental well-being, although unfortunately, many of them did not come up as statistically significant. So we can't conclusively say that the evidence is there at that point. And I think one of the primary issues that we had is a relatively small number of people in the study, which can make it difficult to see those statistical differences. So based on this study alone, I think there's certainly evidence that dog ownership can have a positive effect on our mental well-being for some dog owners. When we consider the whole population, the evidence isn't conclusive at this stage, and it just points to the fact that we do need more research in this space. But I think it's really important here to notice that absence of evidence is not necessarily evidence of absence. All of these things that we're measuring are difficult things to capture. Feelings of loneliness and psychological distress can be quite difficult for people to report. And there's issues that perhaps people didn't want to report how they were truly feeling, or, my presence when I'm asking them these sorts of things may have had an influence as well. So there are certainly lots of challenges that we face when conducting research in this space. And I think that as we progress and as the field continues to see more and more robust research come out, I think we will continue to see this sort of trend. But at this stage, the evidence is not necessarily conclusive. And just quickly, I would like to thank my supervisors that supported me throughout the process, and particularly Manos Stamatakis, who is still at the University of Sydney and still continuing this human to dog research and interaction space. And obviously all of the shelters and Animal Medicines Australia for supporting us throughout the study as well. And so Marlee, I think I will send it back to you.
All right, that was an awesome presentation. Thanks so much. And I love the memes as well. That brought to life. So now on to Dr. Jennifer Kent. But before I introduce her, I'd like to say I forgot to mention that it'd be awesome if everyone could put their questions in the Q&A function. It would be awesome if you could direct it to a particular person or both speakers, depending on what you're interested in. Try and keep your questions simple. If you have any comments or kind of longer comment type things, you could always send one of the speakers an email and have a chat offline. So off to Jennifer Kent now. Jen is a senior research fellow in the urbanism program at the University of Sydney School of Architecture, Design and Planning. Her research interests are at the intersection between urban planning, transport and human health. She specialises in combining quantitative and qualitative data with understanding from policy science to trace the practical, cultural and political barriers to healthy cities. Key issues that she's examined to date include parenting and private car use, companion animals and transport, the links between health and higher density living, the interpretation of health evidence into urban planning policy, the health impacts of extended commute times, and cultural and structural barriers to sustainable transport use. So now over to you, Jen.
Hi, thanks a lot, Marlee. Thank you for that introduction and good morning, everyone. I just thought a little fun way to have a break would be for everyone to use the Q&A function to put the name of your dog. If you own a dog or if you have a dog that's been special to you in your life, we'd love to see their names show up in the Q&A function. So my research in this space has actually caused quite a lot of contention, and some of that contention has come back at me this morning after I did an interview with Robbie Buck and Wendy Harmer on 702. Apparently we kind of broke the text line as people were texting in not happy with my proposition about pets on public transport. But anyway, we're here today to talk about dogs, and I want to say that we're here talking on Aboriginal lands and acknowledge that. I'm meeting you this morning in Abbotsford in Sydney, Australia. I live and work on the traditional lands of the Wongal clan, one of the 29 tribes of the Eora Nation. And I want to acknowledge just now the traditional custodians of these lands and to acknowledge elders past, present and emerging. I live on a cove of the Parramatta River in Sydney, and it's highly likely that a woman sat as I'm sitting on this land prior to European invasion. It's also highly likely that she too sat here with a dog. Dogs form a large part of Indigenous Australian life and mythology, and an association first developed with the dingo and later with the domestic dog. The relationship is intricate but unique in that these people never domesticated the wild dingo. Neither were dingoes ever seen as a source of food, it appears, nor in many cases considered practical hunting assistants. Yet they were highly prized. Apart from featuring heavily in Indigenous Australian spirituality, recorded advantages of camp dingoes include them being protectors, bed warmers, and also companions. So I'm going to be talking to you today about the way that cities accommodate dogs, and I'm just having a little bit of trouble with my PowerPoint slides, so just bear with me. Now, dogs are popular in Australia. Over 40% of households currently enjoys the company of a humble hound, and apparently post-COVID, this has been on the increase. While dogs are increasingly popular, at the same time, our cities and our lives in cities are changing. More of us live in smaller spaces. Many of us want to travel by modes that are other than the private car. We don't want long commutes and traffic congestion. We're increasingly attracted to quality public open spaces, and we want walkable access to cafes, small shops, and the community infrastructure that we all intrinsically know make a connected and a strong community. These things provide us with a sense of belonging and enable us to live the lives that is promised by a city. So against this backdrop of change, I'm going to focus on two particular things. First, the shift to high density living and increased rental tenure. And second, the shift to lives less reliant on private car use. My research is on the latter, so I really hope that you don't mind me focusing more on transport for today. But first to housing and dogs. Now, anyone living in Sydney over the last 10 years or so would have noted that our skyline is increasingly dominated by cranes. We're building apartments at a rapid rate, and less of us are living in the detached dwellings that once defined the Australian dream. In 2018 in Sydney, there are only about 2 occupied separate houses for every occupied apartment, and within the next decade or two, that's meant to even up so that there'll be the same amount of occupied apartments as there are detached houses. This shift is combined with a decrease in home ownership as the default tenure model and increasing demands for affordable access to rental and social housing. So what does this mean for dogs? A higher density living and the normalisation of rental housing markets do not preclude dogs in cities, But just like many other issues such as parking, washing, noise, the use of space, these things do raise question of regulation, rights and access. This has been the subject of a brilliant report authored by a team led by Dr. Wendy Stone from Swinburne University of Technology and just released by the Australasian Housing and Urban Research Institute. The report provides a comprehensive overview of the different ways companion animal ownership is regulated through housing systems that play out across in people's lives across Australia. The report found that the right of households to keep pets varies markedly depending on the housing sector and tenure within which you live. These variable rights have the potential to not only impact some households' ability to have a dog, but they also significantly influence the housing trajectories of households that already include dogs. Emerging evidence shows that some tenures, such as the private rental sector, bring particular challenges for pet owners. There are challenges not only for those already in the sector, but also for those seeking to access the sector, such as those leaving home ownership for whatever reason, launching from the family home, or seeking to move out of social housing. There's some great work being done in this space in Australia, and for further information on the housing and tenure aspect of keeping dogs in cities, I really urge you to have a read of their report that can be accessed online. So while it's imperative that we ensure dogs can be included safely in the home, I'm more interested in the way that we regulate dogs in public spaces in our cities, and particularly on public transport. So I realise that many people might have tuned in today and that may be after more information on the way we plan for public open spaces for dogs and how we regulate dogs in public more generally. There's a lot of amazing research in this space. Emma Power from Western Sydney University, Simon Carter from Melbourne, Leslie Instone from Newcastle, and Hayley Christian and Lisa Wood from Western Australia are some of the key names. Unfortunately, I really can't cover it all today. And at the end of the presentation, I'm going to provide my email address. And if there's something specific that I can get you some information on, please don't hesitate to reach out. So now on to dogs on public transport. So my research generally as an urban planner is all about the links between built environments and health, with a particular focus on transport. I'm really interested in the health impacts of private car use, both positive and negative, and I've been exploring this for about 10 years now. For many reasons, we really need to reduce car dependency in Australia. The private car is implicated in a lot of big evils like climate change. It's linked to health impacts ranging from deaths and injuries from traffic collisions to respiratory illnesses to the mental health impacts of long distance commutes and exposure to ongoing traffic noise. To mitigate the impact of some of these ills, we really need to be more dependent on other modes such as public transport, walking and cycling. But unfortunately in Australia, we're very stuck in a cycle of car dependence. This is because for many of us, there's no viable option for our transport needs. And for others, the options that are available are just not as appealing as the privacy, convenience, flexibility, and comfort that's offered by the car. In other words, in many ways, the existing public transport system in Australia, including our public transport systems here in Sydney, are just not designed to operate to support the day-to-day needs of those navigating modern, messy and complex lives. And my research is all about trying to reveal how this happens and how it can be changed. So now to dogs on public transport. One way our transport system supports car use over public transport concerns the way that people travel with dogs. Well-managed dogs in public spaces can be good for both individual and social health, as Lauren's just explained. As I said before, a lot of people own dogs, nearly 40% of our households. For one reason or another, it seems that people like to travel with their dogs. They obviously need from time to take them to the vet, but there's also an increasing propensity for people to hang out in public with their dogs, whether it be a Sunday afternoon at the pub or a trip to a new park or a cafe. There's general consensus that this is a good thing if it's managed properly. But the problem in Australia is that because dogs are very restricted from using public transport, any trip that people do with their dog that is more than a walkable distance for either the human or the dog needs to be done using a car. In short, it seems that dog ownership in Australia is a pretty car-dependent affair. And as a dachshund-loving transport researcher seeking to reduce reliance on private cars, this is really interesting. It's something that, together with my colleague, Dr Marlee, I've been interrogating for a good 5 years now, and some of our publications are listed here. Now, our first study was conducted in mid-2015. We recruited about 2,000 dog owners to a 15-minute online survey which asked about the different activities that people do with their dogs, how often they did them, where they were located, and how they travelled to access them. We also asked people what they think about the existing limitations on pets on public transport in Australia. So the key finding of our study was basically that people travel a lot with their dogs and that they often use a car to do so. In summary, the sample of about 1,200 Sydney dog owners that were used for the analysis made 9,633 dog-related trips every week, and 4,832 of these trips started in a private car. This results in each household making about 3.8 dog-related trips by car per week. There's more than currently 1.6 million households in Sydney. 39% of these households owns one or more dogs. It's therefore possible that there are approximately 2.4 million dog-related private car trips occurring in Sydney each and every week. I found this pretty astounding. Now, our survey finished with questions about the use of public transport with dogs. Pets are currently pretty limited from travelling on public transport in Sydney, and participants were first asked whether they would support a change to this policy. Unsurprisingly, 95% of the dog-owning respondents to our survey replied yes. Of more interest, however, is that almost 75% of participants indicated that allowing dogs on public transport would somehow change their behaviour. In most cases, this was simply getting out and about with their dog more, but over 20% of participants indicated that such a policy would encourage them to consider shedding a car. Now, recognising that any change to the pets on public transport policy in Sydney requires a more balanced understanding of community sentiment than a survey of dog owners, in 2017 we conducted a survey of both dog and non-dog owners. Our primary method of data collection was again a self-administered online survey, but this time we used a survey panel company to recruit participants to ensure a balanced sample. The first data set contained about 1,000 records with 39% of respondents living in a household with one dog, which is reflective of the average for Australia. We first provided participants with an explanation of how such a policy might work. This explanation is up here in this slide. Now, given that pets are currently, we then asked the question, given that pets are currently restricted on public transport, how would you change your behaviour? Respondents, how would you support a change to this policy? Respondents could answer yes, no, or I don't feel strongly either way. Now, the top table here shows the results. While over 57% of respondents supported the policy, quite a concerning 23% did not support the change. Respondents were then asked to consider whether they would change the way they would use public transport should a dogs on public transport policy be put in place. Again, an alarming 21% of respondents indicated that they may use public transport less should the policy be changed. In this survey, we also received some open-ended responses which began to paint a picture of some of the reasons people might be for or against a pets on public transport policy change. Our third data collection effort in this series had its focus on better understanding this support or lack of support. We also did a discourse analysis in this data collection effort of comments on an article that we'd published on pets on public transport in the academic press, The Conversation. Some of the comments were really colourful and interesting, but the real value of the analysis lay on the way it helped us understand resistance to the policy change. Many people were concerned about things such as mess and smell, as well as allergies. Giving us some hope, a lot of the concerns that people raised were things that could be addressed by proper management of the policy's implementation. I don't have time to go into the findings of this third study. It's about to be released in the International Journal of Sustainable Transportation, and I can email you a copy of the article if you'd like. So now on to the fourth and final study. This research was conducted last year, and we did an analysis of 130 dogs on public transport policies from Europe, Australia, and North America. What we wanted to understand was how some countries can make this pets on public transport situation work, and what are the things that are different in these countries that might not be in place here in Australia. I'm going to focus on one variable of interest, and that is definitions of national culture. Now, we used what's called the Hofstede model of national culture. With the 130 studies that we looked at in Europe, the UK and Australia, as well as across the US, we found that the majority of European cities and some North American cities currently permit pets on public transport. But most Australian cities are pretty limited in their support for this policy. The policies that we analysed displayed several aspects of diversity, which was surprisingly sophisticated, extending beyond simply prohibiting or permitting dogs to ride public transport. Less restrictive limits were those that constrained the dog to one particular train carriage or an area of a bus. Limits were also temporal, with dogs prohibited from riding public transport during peak hours. And finally, many policies also place financial limits by charging a fare for the dog. We developed a 3-point dog friendliness scale to capture these nuances, and this was applied to the policy governing each service. About 2/3 of the transport services we reviewed allowed dogs to travel with very few restrictions whatsoever, and only one of these services was in Australia, with the remaining located in the UK or in Europe. All but 3 of the services entirely prohibiting dogs on public transport were actually in Australia. Of the 85 services permitting dogs on public transport, 57 of these enforce some kind of a restriction, while still allowing the dog to travel outside of a container. The most common limitation by far was just the need to purchase a ticket for the dog to travel. Now, as I said before, to measure nuances in national culture, we used the Hofstede Indices of National Culture framework, which is based on an ongoing survey of value systems of people around the globe. The results of the survey are then subject to a factor analysis, resulting in scores from 0 to 100 allocated across 6 dimensions of national culture. These dimensions are related to things such as respect for authority, acceptance of social inequality, levels of comfort and unpredictability, individualism, and future thinking. Our analysis of the correlations between these indices of national culture and whether or not a country allowed people to take their pets on public transport found a really high level of correlation between these cultural dimensions, but it wasn't in the way that we actually expected. Our results should suggest that countries where dogs are permitted to ride public transport are countries where hierarchies are accepted, restraint and a long-term view of things are respected, uncertainty is avoided, and people are cared for in groups rather than considered as individuals. The common thread that emerged is a sense of conservatism and safeguarding of both the status quo and of the collective. In many ways, it describes quite an unadventurous culture. These are not countries that routinely throw caution to the wind in the pursuit of short-term gratification or of an enshrined sense of the protection of the rights of the individual. At first consideration, these are characteristics that actually suggest a situation more readily associated with public transport that prohibit rather than welcome dogs to travel. To travel with a dog, we know, involves some objective risk. For example, even a well-trained dog can act impulsively when afraid. It's also a prioritisation of the rights of one passenger type over another, and an indication of a society where public transport is equally accessible to all. Yet countries that allow dogs on public transport are willing and able to accept this risk and prioritisation, and the resultant opening up of a service to all, even though such acceptance and action is not necessarily congruent to their approach to other issues. This finding has several implications. However, we first need to acknowledge that cultural dimensions provide the policy context here rather than really explain what's going on. What I'm saying is these findings don't suggest that dogs are being permitted on public transport because these countries are conservative. The fact that countries are conservative yet still allow dogs on public transport, however, provides an insight into the way national culture shapes the environment in which policies on dogs on public transport are made. Now, the first implication of relevance to countries who currently prohibit dogs on public transport, like Australia, is that policymakers in these nations can be reassured that the cultural context in which a policy change might occur need not be overly speculative or experimental. Related to this is the possibility that dogs on public transport in countries where it is permitted is a common and everyday occurrence. It's an insignificant occasion and a triviality that need not be received with fuss or undue ceremony. The public transport system just accommodates it, just like it accommodates the rest of everyday life. This suggests that for these countries, public transport is a very normalised way to travel and a way to accomplish the day-to-day tasks that are associated with modern life. In countries where dogs are prohibited, however, the system is less open and available and perhaps only suited to trips that are predictable and clean, such as the journey to work. So to sum up, the overall findings of this big block of research is that people like to travel with their dogs, and if we want to encourage this in the context of also encouraging a shift away from car dependence, we really need to allow people to take their dogs on public transport. From a transport planning perspective, dogs have shown us that our public transport system is lagging behind other countries where public transport is more popular. While dogs on public transport is the example that I've used here, there are a myriad of other seemingly inconsequential trips that make up modern life that need to be accommodated by public transport services if they're going to become mainstream modes of travel for people in Australian cities. So thank you very much. Thank you to Lauren, and I'll hand you back to Marlee for questions.
All right, thank you so much. That was fascinating. And I had to comment quickly, although I know I'm taking up precious question time, that the two talks seem to work so well together in the way that, you know, as Lauren found that, or Lauren commented on that article that was describing the difference in mixed results between dog ownership and loneliness. And you can't help but think that if loneliness is this sense of feeling like your social life isn't what you want it to be, and has lots of links to the cultural context in which you're in, that if you live in a society that doesn't allow you to live or contain one of your most meaningful relationships out in public space, and you have to make a decision between spending time with your dog and then, you know, going shopping or eating food or, you know, traveling to work or anywhere, then you're really not going, you might have a situation where, yeah, having a dog could, you know, potentially cause more loneliness, or not living in a society doesn't allow the proper mental health benefits of dog ownership to become or to reach fruition. So it's a fascinating area. So because I am obsessed with my own dog, I'm just going to pop on this question on the screen. Where is it? Oh yeah, here we go. Back to Winnie. All right, so now over to questions. So please, I've got a few already, but please keep on sharing in the chat, keeping things as questions, not comments per se. But I'd like to start from the beginning. So a question from Anonymous on Q&A aimed at Lauren. You mentioned that your presence may have influenced results. Were the questionnaires you used to talk to dog owners completed in person?
Yes, so great question. Yes, they were. And the reason being was that we also collected a range of other health measures that required us to be face-to-face with participants. So things such as their blood pressure or their cardiorespiratory fitness, in which they had to do a step test up and down with a heart rate monitor. So those sorts of things meant that we were face-to-face and therefore they completed the questionnaires face-to-face. Except the findings of my study are being used to inform a future study. And in that study, I know that we're planning to, or Manos, I shouldn't say we anymore, but my previous team are planning to alter the study design slightly. So people will be using iPads to complete the questionnaires, and that will hopefully reduce any possible influence that, you know, a researcher can have on people's willingness to share their feelings about mental health.
Great point. So I might pop over to a question for Jen now. So this is a comment here. In much of Sydney, it appears that dog owners are the last group to be considered when public parks are planned. When dogs provide such an important role in people's lives, why does this bias exist? The Dutch approach dogs in public places differently. Off-leash parks are the norm, not the exception. Can you comment on this?
Yeah, thanks a lot, Louisa, for that question. I think my answer is that in much of Sydney, green open spaces are highly prized and access to them is increasingly constrained as our population is growing. So it's not only dogs that are not necessarily planned for, but it's all sorts of different groups that are missing out. You know, people of all sorts of abilities, providing spaces that are quiet for time out, etc., 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 etc. As our cities are growing, land has become prized, as we know from our property market, and we just don't have enough public open space to go around. That we should. I mean, that's a planning fault. That's not something that we couldn't avoid. We should be prioritising the provision of public open space for all sorts of uses, including for dogs. In terms of the difference between off-leash parks and on-leash parks and so forth, I know that differs from local government area to local government area, and that's also, I think, an issue that we have is there's no sort of state government leadership in this space from the state planning department to really consider what is a suitable thing across the board. So I know in North Sydney, for example, it's a default off-leash. And it's only in specific spaces like in close proximity to children's playground areas that you have to have your dog on leash. So it does differ around Sydney as well. I think we need to be careful that we don't sort of just think across the board. But my key answer is, yep, public open space is highly prized. It should be more readily available in Sydney, and as we densify our cities and our cities grow, we need to do a better job of prioritising its provision.
Okay, so now I'm going to ask one that's directed at both the panelists to incite a bit of conversation. So this is also from Louisa. The majority of our 2,000 members of Callan Park dog lovers report that walking their dogs in off-leash, unrestricted areas of the park is far less stressful than having to exercise their dogs off-leash in an enclosed fenced area because the dogs are trapped in close proximity, and dogs are more likely to be aggressive. Is there a study on this I can access? I suppose I'd like to broaden that more to talk about potentially, Lauren, if you could talk about your current work a little bit in context of the kind of well-being of dogs themselves.
Yeah, absolutely. So currently I'm working with the veterinary faculty and the program of shelter medicine. So I specifically focus in animal shelters, and a big part of that is looking at why animals are relinquished to animal shelters. And behaviour is a really common reason. So a lot of my research at the moment does focus on animal behaviour. And I think that what these dog owners are anecdotally reporting is certainly the case for some dogs. You know, when you have a large number of dogs in an enclosed space, and dogs can't necessarily get away from a dog if they're feeling threatened, or, you know, they're feeling fearful and they can't escape that situation, this is when dogs can become aggressive. So it's not surprising that you are potentially finding that there is more conflict in that enclosed space when animals can't avoid situations that they don't want to be in. From a town planning perspective, that's certainly something that Jen could speak on more so than me as to why there's potentially more on-leash parks and not off-leash parks. But from a behaviour perspective, it's not something that I'm surprised to hear.
Yeah, I think that's a great answer. It's a balance that we have to get right, isn't it? And it's just a matter of working it through with the community, I think.
Okay, so Jen, I'm going to pop another question over to you. Is there a correlation between city density and a willingness to let dogs on public transport, i.e., is it possible that Australia lags because we are have a more traditionally have larger yards and people expected dogs to stay at home, and B, public transport is a much more common way of travelling, i.e., cars were not traditionally a possibility?
Yeah, wow. This is really complex, and the answer, I do know the answer. There is a correlation between what our study looked at was a correlation between car ownership and pets on public transport provision, and we found that countries where car ownership is higher are less likely to allow pets on public transport, which says a lot, I think, about the public transport system. Whether or not that's related to, so in countries where car ownership is higher, generally the density is lower. Anybody who's into planning will know that. Whether or not that's because people have dogs in their backyards more, I don't have specific data to answer that. But what I do know is we did do a survey of attitudes to dogs in our second study, where there's an attitudes to dogs questionnaire that you can ask people. And we found that, because we did sort of suspect that perhaps in Australia dogs are considered more of a private realm thing. We sort of were wondering whether there was some kind of cultural nuance there. Our survey, though, didn't show any different results in attitudes to dogs in Australia than in similar surveys that had been conducted in London, where pets are allowed on public transport, and in Spain, where many cities allow pets on public transport. So Australian attitudes to dogs as being sort of things that are meant to be out and about in public or not didn't vary in that survey. So I don't think there is necessarily a thing when it comes to sort of dogs should stay in your backyard and not be travelling out and about in public. If anything, I think we're sort of definitely shifting towards dogs being more public animals than what they ever have been before. And it's sort of a thing that's being experienced in cities around the world, and we're not any different in that respect.
Great answer. So Lauren, I have another question for you, which leads on to a question I personally wanted to ask. So this one was about the timing of your study. So was there a population scale stress event like COVID, which occurred at the same time? But also I was fascinated by the different starting points of your groups and where there were, in terms of mental health, and the dog owners, the laggers, and the third group. Were there any particular differences in the profile of those groups to start off with?
So firstly, to answer the question regarding COVID, so this study was conducted prior to COVID. I think we finished data collection in 2019 from memory, so that was all finished off before then. As for differences between the groups, we did find that people in our community control group were generally older and often had higher levels of education. I think this stems from how we recruited our participants. So basically, the university sent out a lot of emails and newsletters, and we reached a lot of community control people through that avenue. So therefore, being associated with the university, people often had higher education degrees. Whereas our dog owners themselves, we recruited primarily through a website called Pet Rescue. So it's basically like Google for rescue dogs. You can go on and search the available dogs from all the different rescue groups, and they put a little pop-up message for us. And so by recruiting dog owners through this website that many different people look at and look for dogs through, I think we did end up with some population differences there. And again, that's something that we would hopefully address in future studies and try and balance out those recruitment methods a bit. I think it's difficult to read too much into the baseline differences between the groups, given that there was only 71 people across the whole board. So I wouldn't necessarily go away and say that dog owners people who are interested in dog ownership always have higher levels of loneliness at baseline. I don't think that that's a conclusion we can make. I think that it may have just been something specific to the study that we did. And yeah, something that hopefully could be ironed out with a larger sample size.
Cool. Yeah, and it's difficult, and there's something you said offline around the way that this kind of working with dogs in research it's difficult, and more difficult than just working with, for instance, undergraduate psychology students or something.
Absolutely. I think that one of the biggest challenges we ran into was that you know, everyone's human to dog relationship is so unique, and there's so many different elements, you know, the amount of dog walking someone performs, or their level of attachment to their dog, or even their personality or their dog's behavior. All these different things really come into it, and can therefore affect mental health. So it's a very difficult area to do research in.
Totally, but it's a fascinating study, so I'm glad you persevered. And I also, there's a compliment. Thank you both, Jennifer and Lauren, for your great talks from Manos. But then a question for Jen, and asking why she thinks Australian policymakers are so hostile and indifferent to the needs of dog owners, particularly when it comes to public transport. What action do you think it would take to convince them to harmonise legislation with other modern cities around the world which allow pets on public transport?
Yeah, thanks a lot, Manos. Hello. I think what this research is sort of saying is not necessarily anything about dogs, but more about our public transport system, which remains underfunded and incompetent for the task that it has to accomplish. So our public transport system is stretched to the limit at the moment, and to put in anything additional, like a nuance like taking a dog on public transport, seems to be just way too much for Transport for New South Wales and for the system to cope with. So it's coping with so much, not only in the context of COVID, this was going on before COVID, and it's going to be happening after COVID, in terms of trying to carry around a city with a burgeoning population, that it just doesn't have the bandwidth to be able to fathom something as relatively simple but as different as taking a dog on public transport. I think what Transport for New South Wales would say is, look, we need to get the carriage of people right first. My response to that is, yeah, we'll go ahead and do it. Get the funding, get the investment, get the infrastructure, make the system be a world-class system, and then it can facilitate the development of a world-class city, which includes people taking their dogs to the vet, includes people taking their kids to childcare, includes people using public transport to do their shopping or to go to Bunnings. Doesn't just provide a public transport system for people to get from the suburbs into the city wearing suits, usually white males. You know, our system is just entirely based around that commute to work. We're obsessed with it. But that's only about 20 to 30% of the transport task of a city. All the other trips that people do in their day-to-day lives are not about getting to work, and our system is just not good enough for that. And dogs are sort of, you know, they're teaching us that, like they teach us so many other things in life, that our system is inadequate. That's my response.
Well, I think a lot of us are in fierce agreement that the public transport system, at least in Sydney and elsewhere, needs to become more egalitarian and just high quality. I think we have time for one more question as we're edging to the end. To both of you, from Nicole, would public education campaigns so people know how to react to dogs in public spaces, i.e. not to approach a dog to pat without checking in with owners, help? Would education for general public as well as owners help? Example, those special collars some dogs wear, advertising the mood of the dog.
I'll just say something quickly from our research and then hand it over to Lauren to finish up. We actually found pockets of real acceptance of our pets on public transport policy in Sydney, and what our recommendation was that to go to those pockets and have trial runs for people to be able to take their dogs on public transport, make it something special and exciting, have education campaigns, make it a really successful trial to start off with. I think that would be a great way to introduce the transition. So Lauren?
Yeah, great question. I personally, as a foster carer who often has dogs that, you know, come from the shelter and struggle a bit meeting new people and new dogs, I love these collars. I think they're great. I think education campaigns in general are really important. One thing that I'm learning over here as I'm looking at behaviour and in people that are often struggling with their dog's behaviour and how to best manage it, is that the general public, but also dog owners themselves, often have a somewhat poor understanding of their dog's behaviour. So I think that it is really important, particularly when we're talking about public transport, but for so many other elements of dog ownership as well. you know, avoiding bites among children, or even like avoiding the stress of dealing with a dog that has behavioural issues. All of these different elements could really benefit from campaigns that help people understand their dog's behaviour and respect dogs that are uncomfortable interacting with strangers or other dogs. So yeah, I think that's certainly an element that we need moving forward.
Awesome. Well, thank you so much to both of our speakers today who did an amazing job. And I forgot to say thank you, especially to Lauren, who stayed up late into the night to be with us today. It's fantastic. So just letting everyone know that this recording will be put onto the Matilda Centre YouTube in a few days, along with all the other built environment mental health webinars that have occurred in the past. So if you want to share it around with other people, please feel free. I know that Jory said in the chat, do policymakers do this kind of presentation? There are some in the audience, but you know, please share around to anyone you know, and we will advertise it later on. And don't forget to reply to the little survey in the follow-up email tomorrow. So thank you so much.